program 2021, organized by Faculty of Paramedical Science, AdtU, on the theme of evaluation of SARS-CoV-2 infection, its diagnosis and management, perspective from the healthcare professionals, which was continued from the 2nd of August. And today it is the 3rd day, and this is the 5th session of our event. In this first session of the 3rd day, our eminent guest is Dr. Jit Patwari, who will deliver his lecture on the preparedness of healthcare industry for future medical catastrophes. So before starting, I would like to have a brief description of sir. So Dr. Jit Patwari is a qualified healthcare management professional, trainer, planner, and strategist with nearly 2 decades of experience in serving government hospitals, corporate hospitals, missionary hospitals, corporate houses, etc. He had completed his MBBS from Guwahati Medical College with a degree in hospital management from Apollo Institute of Hospital Administration, Apollo Hospital, Hyderabad. He served many prestigious institutes and organizations like Christians Limited, Ernest Limited, Max Healthcare, Ernest & Young, UNICEF, IIM Shillong, to name a few. Currently, he is the managing partner of Pinnacle Healthcare Consultants, a firm involved in designing and operations of healthcare facilities, professions, optimizations, implementation of NABH, NABL, etc. He worked closely with IIM Shillong and is a member of the expert committee for healthcare management. He has designed and implemented courses at IIM Shillong and was awarded the most valuable resource person for his contribution in sustainable healthcare management system. He is an advanced level certified professional for quality implementation in hospitals by Healthcare Sector Skill Council, Government of India. He has written 2 books on hospital management and many periodicals and articles for books and magazines. So I welcome you, sir. And I request you to carry forward the session with your valuable speech. Over to you, sir.
Yeah, thank you, Arnab. Am I audible?
Yes, sir. Yes, sir.
Yes. Thank you for welcoming me to this program of faculty development program. Before that, I would like to switch on the video. Okay. Arnab has already given my background. So basically, I'm a doctor by profession and also a healthcare management. More towards shifting now to healthcare management, planning and designing of healthcare, preparing the strategies and all those stuff and all. Now, the topic which has been assigned to me to deliberate on today's lecture is on the preparedness for catastrophes. Everybody knows about the recent pandemic, or the current pandemic, I would label it as, and it has created a havoc in the entire world. Now, the subject is very vast, if at all we need to discuss here, but I'll try to touch upon the salient points as to, we will try to understand what happened, then number 2, what went wrong and what could be done in future so as to prepare ourselves to face maybe a similar kind of catastrophe or maybe some other form, but the basic principles remain the same. May I request the admin to allow me to share my screen, please? Yes, is it visible?
Yes, sir, it's visible, sir.
Okay, just a second. Okay. The topic that we are going to discuss is preparedness of the healthcare industry for future medical catastrophes. Before we go to it, this is the firm I'm representing today, Pinnacle Healthcare Consultants. These are the books which Arnab had mentioned. and these are the programs which I have conducted IIM. Now, what we expect in healthcare is when we enter a hospital or when we look at the healthcare scenario of a country, or maybe in our region, in our place, in our city, or maybe in our hospital or any other place that we work in, we always expect something like this, a very disciplined way that we go ahead with. But in reality, what we see is something like this, where we have a very haphazard kind of an environment, where everybody is trying to push their way out through the chaotic situation that is there in the hospital. Now, we compare it with the OPDs in the hospital, we compare it with any other scene or any other workplace. We consider it now the biggest problem that the healthcare providers and the administrators are facing with, is with the vaccination of for the coronavirus. Now we get a similar situation like this. The online registrations are there again. Still, people really want to jump the queues and take the priority. So this is what actually we face when we talk about delivery of healthcare. This is a normal scenario that we face in our country, all over the country. This is AP 28, this is Andhra Pradesh, somewhere near to Hyderabad. This is a scene. Now imagine in normal scenario, we have something like this. And what will happen if there is a disaster, if there is a catastrophe? Now, are we prepared for it? Many would say, very few would say yes. Few would say, no, we are not prepared for facing or to face a catastrophe. Few people would say that, no, I really don't know as to whether we are prepared or not. Now, this is what we are going to discuss, just a brief. Now, what we mean by disaster or a catastrophe. Now, disasters are global interest because they cause a lot of suffering and damage to human populations and the environment. Whether we, I'll just read this out and then we will discuss. The 21st century has witnessed several disasters which have killed and displaced hundreds and thousands of people. About 1.2 million people are killed by disasters between 2000 to 2012. Estimated damage worth 1.7 trillion US dollars. Now, the second definition as given by the American Red Cross is a disaster can be defined as an occurrence, either natural or man-made, that causes human suffering and creates human needs that victims cannot alleviate without assistance. I cannot do it if at all I'm not assisted by somebody, maybe a rescuer, maybe a doctor, maybe an administration part, maybe somebody from the defense personnel. Now, a disaster, according to the World Health Organization, it says that any occurrence that causes damage, ecological disruption, loss of human life, or deterioration of health and health services on a scale sufficient to warrant an extraordinary response from outside the affected community or area. Now, this is very difficult to remember. But I do not have any other option but to read it out because I cannot create a definition as such. Now, we'll go back to the previous slide. Now, disasters are of global interest because a lot of humans suffer. Now, when there is a disaster, maybe an earthquake, which is very common in this part of the country. Again, in Japan, in Indonesia, there are countries where a lot of disasters happen. In Assam, every year we face something in this monsoon season, that is the flood. And we have now, the experts have said that 21st century has witnessed several disasters, but that is on a global platform. But what we see in Assam is a regular feature, and many other states in the Northeast, I would say in particular, would have this annual problem that is there all the time, and that has displaced hundreds of thousands of people. Many people, their lives are lost. Somebody, the houses or the cattle or the sources of earning, those are washed away, and they are forced to move on to another place. Now, this has killed, so this is the data which the experts have given. Now, how do we classify a disaster or a catastrophe? Maybe according to the speed of onset, that is sudden or slow onset. Sudden would be maybe an earthquake, maybe a volcano, maybe floods, if at all it is released by from the reservoirs or the dams. Then origin, maybe natural or man-made, floods, fire, all these are natural. Bomb blast, mass casualty, where it is there. Now, again, the scope, which is a minor, major, or catastrophic. Minor can be tackled easily. Major can be tackled with some greater efforts. But catastrophe is something which is beyond our control. But at least we should not give up. We should join our hands together and try to minimize the effect that is caused on the people, on the geography and the environment and the other aspects. Now, according to number 2, origin or the cause, which is natural or man-made, the current pandemic that we are having, there are a lot of theories or hypotheses, I would say. Somebody said this is Wuhan virus because it originated in the Wuhan lab. Somebody said, no, this is a biological weapon prepared by somebody from the US is also linked with it. But there is no definite evidence that is there to establish the fact that this is a man-made. But these are speculations and the observations which we have, or the notions that we have that these are man-made. But whatever be the case, whether it's man-made, whether it's natural, but the effect that the virus is having, we have to face it and prepare ourselves to prevent the destructive results. Now, before we go into the second or the next part of the presentation, I would like to take you through these definitions. Now, there are 3 aspects that we need to consider. One is hazard. What is it? Any phenomenon that has potential to cause disruption or damage to people and their environment. Now, there is, again, I would come to the third one, the vulnerability. Somebody is vulnerable. When we talk about NABH, we talk about the quality of care. We label people or classify patients as vulnerable patients. Now, who are these vulnerable patients? The extremes of age. Now, why they are vulnerable? Because they are more prone to diseases, they are more prone to the adverse effects. Now, in such a case, vulnerability, the conditions determined by the physical, the social, economic, and environmental factors on processes which increase the susceptibility of a community or a person to the impact of the hazards. Something is hazardous. If at all there is a hazard, people who are vulnerable will have a greater adverse effect than a normal person, or person who is stronger than the normal people. The second one is the risk, the probability of harmful consequences or expected losses, maybe the deaths, injuries, property, or whatever, then resulting from interactions between natural or human-induced hazards and vulnerabilities. Is there, but is more vulnerable, so the risk is high. The hazard is there, hazard is the constant, vulnerability is low, then the risk is also low. So the formula that goes into when we are classifying a disaster is somebody who is at risk. Now, risk is proportional to hazard into vulnerability by the level of preparedness, how prepared we are. The floor is slippery, but we are prepared while walking. So our risk is lesser. We are wearing slippery shoes, so our risk is more. So similarly, there is a disaster. I'll confine myself to the pandemic here. Now, I am not vaccinated. I am obese. I have diabetes. I have got cardiac problem. I have got renal problem. So I have been exposed to positive patients. Now, in such a case, the hazard is there. Now, I'm more vulnerable because of my predisposing factors that I have in my body. So and I'm not prepared. I'm not wearing a mask. I'm not washing my hands, and I'm contaminating my hands and then touching the nose. So the preparedness is less. So my risk is going to be really very high. Now, what are the factors which are there? Arnab, once in a while, I'll just ask you whether the slides are visible or not.
Yes,
Is
sir.
it visible?
Yes, sir, it's
Okay.
visible, sir.
The factors affecting disasters. Number one is the host factor. What could be the host factor? Number one is the age, whether it's a child or elderly people. Now, in case of this pandemic, till now, till second wave, the children are more immune as compared to the adults. Then the immunization status, whether I'm vaccinated, I'm not vaccinated. It is evident but not completely established that people who are exposed to the virus and then developing the disease after getting vaccinated has a lesser intensity of the disease. So that has not been established as a evidence-based kind of a study, but at least the statistics say that this kind of factor might be possible. Now, degree of mobility, then the emotional stability. Now, in this, the government of India and the state governments have also started something called the mental health problems for the COVID patients. In the post-COVID period, many of the patients, they go into mental kind of instability because of the ICU, because they stayed in the ICU for a long time, and then this kind of emotional stability is lost. Now, environmental factors can be physical factors, chemical factors, biological factors, social factors, and psychological factors. Psychological impact is also very important when we suffer from a disease, if at all we break down. So that could be one of the contributing factors to the severity of our problem, not necessarily the disease. Now, this is a chart. I have just copied it from the World Health Organization. So the font size is really very less, very small. So what I'm trying to say is that when the hazard and the vulnerability they meet, there is a disaster. So the hazard is there, triggering effect is there, and the vulnerable patients or the subjects who are vulnerable, they get exposed to this hazard, there is a disaster. Now, coming to this topic of the current pandemic, now what went wrong in this? Now, these are a few snapshots from the leading newspapers. Frontline, India's national magazine says government's all-round failure to manage pandemic, it is exposed. I'm not sure. This is just a snapshot. Whether that is exposed or whether that is not exposed, I'm not going to comment on it. Now, BBC News says COVID-19, how India failed to prevent a deadly second wave. Hindustan Times say that India's health system has collapsed. The Times of India says India's chaotic COVID management, as the politicians took over, time-tested public health principles took a back seat. Now, this is one of the major issues that haunts people all over the country. Now, I'll give you an example. Please note that this is nothing, my comments are nothing related to any politics or any party, any political party, any person or something, but this is just an observation, and this is what has happened in our country. Now, in Delhi, a lot many people, I'll just take you to the next slide. At least 195 deaths from 5 states blamed on shortage of oxygen. Now, again, oxygen, Times of India says that COVID-19 oxygen shortage sparks hunt for these expensive machines. Now, going back to the previous slide on India's chaotic COVID management, politicians took over the time-tested public health principles, and it took a backseat. Now, few departments who gained their importance in this is, number one is community medicine specialist. Number two is microbiologist. Number three is the epidemiologists. Number four is the healthcare management professionals. Now, these four have gained a lot of importance in this pandemic, because setting up of quarantine centers, setting up of the protocols, policies, and ICMR has given those guidelines, but those guidelines are to be implemented. Again, when the patients are admitted, the critical care specialists and the other specialists, they have got very, very important roles to play in controlling the disease. Now, politicians took over in many states. It is seen. I'll cite an example of Delhi. When the center and the Delhi government, there was a tug of war between the center and the Delhi government. Each and everybody on both the sides were trying to push the blame on the other. The entire country would have appreciated if they had joined hands, forgetting their political rivalry, and if they had come together trying to help the people rather than trying to create the or bring out the rivalry, political rivalry in controlling this, the resultant effect would have been far, far better, and people really would have appreciated the good work. The political rivalry could have been discussed in the assembly and not on the streets where people were shouting at each other and trying to establish their fact. So what I'm trying to say is that due importance should be given to the specialists rather than the bureaucrats and the government. Let the bureaucrats and the government be the facilitator, and let the specialists run the show, and that would have been a very big contribution from the politicians and on what we are facing today. Now, COVID-19 in India, patients struggle at home as hospitals choke. Shortage of beds hits Guwahati. 8 of 10 private hospitals say they are full. Now, why this is full? Now, there are so many factors which have contributed to this. Now, number one is we as general public, we are to be blamed for what we are facing today. We do not wear masks. We do not wear the PPEs, the normal one, not the full one. When we deal with the patients, we do not wash our hands properly. We do not follow the cough etiquette. We do not follow the social distancing norms. When we go to the public place, you see a lot of people thronging in as if there is a mela or some social gathering or something, or religious gathering or something. Again, the Kumbh Mela that we celebrated a few months back. So that is one of the biggest disasters, I would say. Again, now for this, we really have to be very vigilant and be very careful for this. Now, all this said and done, and this is few days back, this snapshot was taken from the Ministry of Health and Family Welfare. Now, whatever the political leaders have done, whatever the bureaucrats have done, whatever the medical caregivers, the doctors, nurses, technicians, and the other people, I would like to mention even the cleaners. They also play a very important role in controlling or management of this crisis. Now, what has resulted is the one on the right with the pink block, that is the deaths. So 1.34% is the death. Now that is total is 4,23,217. Maybe 4 to 5 years back I prepared this presentation, so that is on that particular day's figure. But if at all we look at, somebody might say 1.34% only, but imagine somebody, a very close relative of yours, is within that 1.34%. For the people, for the general public, or for the entire world, it is only a person who has lost his or her life. But for the family, it is as if the entire world is lost. So even a single death matters a lot if at all we look at it from the micro angle. Now, what are the lessons that we have learned in this? Number one is inadequate compliance to accepted norms, policies, and protocols. Even the policymakers, they do not follow the norms or the policies at times. For the VIPs, it's a ready to go anywhere kind of a policy. any day, anywhere, any place they can go without having the masks, without having anything. Now, absence of operational management plan. Now, this is something which is very important. We will discuss this, how to prepare this. Then lack of planning and preparedness. Now, last year I was invited as a subject matter expert for designing Northeast's biggest quarantine center in Foresight Stadium, Guwahati. Now there, when I went, people were really very confused, as to what to do. They had the policies in their hands, they had the protocols, they had the documents, but were not really able to convert those into practical or implement those on practical terms. Now, in such a case, what happened was one of the senior person, he had suggested that we should convert the schools into COVID hospitals. My question was, we already are running short of manpower in the sense that doctors, nurses, and paramedics, those are scarce resources in the entire world. In our country, its situation is worse. And in a place like Northeast in particular, where we have scarcity of resources, so that wouldn't have been a viable option. Now, in such a case, what I had suggested is expand the capacities in the existing hospitals so that you don't need to leave those schools unattended. You would admit people will go there thinking that this is a place where we are going to get the care, but because of shortage of human resources or maybe some other resources, the care would have been offered on a substandard level, because that is not the fault of the government or the caregiver, because resources are not there. So somebody cannot overnight create something and then can give it to you. So that was something which was lack of planning processes, and the preparedness, how prepared we are to face this second wave or the third wave, that also matters a lot. Inadequate external and internal and external communication. Now, if at all I cited the example of Delhi, similar kind of Arnab, am I audible?
Yes, sir. You are disconnected
Yeah, I got disconnected. Just a second. I'll share my screen again. Is it visible now?
Yes, sir. Yes, sir. It's coming.
Okay. Just a second. Full screen. It is visible now.
Yeah. Yes, sir. It's coming.
Yes. So if there is lack of communication, though, it is not possible for the policymakers to go to the ground level and then try to find out what is happening, because that's huge. So the ground level workers really need to communicate, and if at all there is lack of internal and external communication, the policies are definitely going to go wrong. The lack of network among different departments and stakeholders. Now, what are the departments which would play a major role? Number one is definitely health. Now, only health will not be able to do this. Now, there would be people who should come from the public works department, the PWD department, then again, the public health engineering department for the water supplies, for the drainages, for the then the municipality should come because of the disposal of the waste, biomedical waste, and so on. and other people like IT and everybody should come and join hands together. Finance is also very, very important, because if at all you really want to drive this project, finance would be one of the key factors. Now, how do we go ahead with this? What would be the approach in this? Now, when we talk about preparing a plan, we talk about from the healthcare management side, I always divide it into three aspects. Number one is infrastructure. Number two is the policies and the processes. And the third is the manpower. Now, these three verticals are very, very important, which would govern the entire chain of activities. Number one. Number two would also determine if one of them is determine the outcome that you are going to have. One of them is not there, the other two definitely would suffer. Your processes are in place, you have got excellent manpower, but your infrastructure is not there. You will not be able to do anything. Your infrastructure is there, policies, protocols, processes, and protocols are there, but you do not have adequate manpower, or manpower, there is scarcity of resources, so nothing is going to happen. You have the best of machines, you have the best of processes and the protocols, but you cannot do anything. There's a line which has come here. I don't know who has drawn it. Some scribbling effect is there. Okay, now vanished. Okay, now when we talk about infrastructure, Assam opens 300-bed COVID hospital in stadium, built in 20 days by DRDO. So this is something which is extraordinary thing that Assam government has done. In 20 days, building a hospital, converting a stadium into hospital, this is not an easy task. Delhi's 1,000-bed COVID hospital built in less than 2 weeks. This is again a very, very commendable job that the Delhi government has done. Now, the next comment which I have written is can be done in days, weeks, or months. Then processes and protocols. COVID-19, government issues fresh SOPs for offices to contain the spread of coronavirus. Then Bombay Medical Council frames SOP for oxygen supply and management for Mumbai hospitals. Now, this can be done in days or weeks. Policies can be framed. If at all you have a good team, you really can form good policies maybe in days or weeks, or maybe in months. Now, when it comes to the manpower, maybe a doctor or a nurse, or maybe the paramedic or the others. Now, it takes years to get a qualified doctor or a nurse or a technician. So this is one of the biggest limiting factors in healthcare, where you do not get qualified manpower. So this is something where you really need to utilize properly. Now, if at all this is in weeks, you get the infrastructure in a couple of weeks. You can design the processes maybe in weeks or maybe months. But to prepare the nurses, you need 3 years, and to prepare a doctor, you need 5 + 1, at least 6 years of time to get a qualified doctor who can write prescriptions as per the NMCs. Now, what are the requisites when we are planning for a catastrophe or a disaster management plan? Now, again, I'm not going to discuss about the disaster management plan in a hospital, where we talk about the infrastructure, we talk about the fire safety, we talk about the electrical safety, we talk about the evacuation plan. No, we are talking about disasters or catastrophes related to the pandemic or in healthcare. Right. So healthcare. Now, what are the requisites? Now, prevention of danger or threat. Now, you really need to understand what is the impending danger that you are going to have. Now, suppose you have seen what is happening. Now, you really need to look into what could be the danger or the threat, how to avoid it. Now, mitigation or reduction of risk of catastrophe, or its severity or consequences. Now, you really need to mitigate or try to find out what could be the risk, try to prevent or minimize the severity or the consequences which might have or which might arise after the catastrophe is over. In case of say, an infection happening, or maybe disinfection, pandemic. Now, even after recovery from the disease, the patients are not in a stable position, maybe financially, maybe socially, or maybe emotionally or mentally. Now, you really need to look into all the aspects while preventing this. Now, capacity building, this would include the training programs and the training of people to manage the baseline kind of problems, and then escalate it to the specialists, which can be done. Now, it is not necessary that the specialists need to look in, specialists will have to look into each and every aspect, even the minor problems. Arnab, can you hear me?
Yes, sir. You are disconnecting again, sir. Yes,
Again, some sort of, yes, just a second. Allow me to share my screen. Visible?
Yes, sir. It's coming. It's processing, under processing. Yes, sir. It's coming now.
Yeah. Thank you. Full screen visible?
Yes, sir. It's coming now. Yeah.
Okay. Now, good foresight and preparedness is very, very important to deal with any catastrophe. Analyze the danger and the magnitude. Now, this is the part of foresight. You need to really analyze what could be the impending danger and the prompt response to any threatening catastrophic situation. Now, assessing the severity of the magnitude, then again comes what comes is the rescue and the relief operations and rehabilitation and reconstruction. Now, I'll give you an example in this pandemic only. I have already discussed rescue and relief operations. It's not like a flood or a natural disaster where we talk about relief operations. But in this case, in the pandemic, we really need to look into the family aspect, the social aspect, the financial aspect of the people, and the another very important is the mental rehabilitation in the entire scene. Now, capacity is visible or not?
Sir, it's coming.
Yeah, capacities and needs. Now, capacity for risk reduction, emergency preparedness, and response and recovery. Now, in countries which are more at the risk reduction, or this is better. Now, factors affecting this capacity include weak health and disaster management systems and lack of access to resources and technical know-how. Now, what happens is in the developed countries, also the preparedness is better, but even in the US, the casualty rate was very high because even though the preparedness was there, health system is very much developed as compared to the developing countries. But the people, the way people moved out for those norms and the processes that led to a disaster in those developed countries. Now, if you look at people who are more prepared, or the hospitals which are more prepared, they have been able to deal with it much better as compared to the one which are not prepared. Now, the technical know-how is also very important. What you really need to look into, the medical part, the management part, the other ancillary services that you are going to need in this, all those technical people should be really very competent enough to handle the situation. Now, disaster risk management for health, number one. Number two is the sustainable development. Now, what is this? It is the reducing risk is a longer term development process, management by communities and individuals working together. Now, when we are talking about sustainability, sustainability itself means it is on a longer run. Now, this pandemic had the first wave, the second wave, and again the third wave that is coming, or people are not really very sure whether the third wave has already come. But what we failed here in this is we controlled the first wave. We could not consolidate, we could not sustain that position or that preparedness, and we became really very, very, what you call, carefree kind of an attitude had come in, and this has led to a situation where the second wave has gripped the entire country. Now, again, the healthcare systems provide core capacities for disaster risk management in health. Now, some countries affected by, if you look at affected by the disasters, have limited basic health services and infrastructure. Now, which itself usually compounds the challenges of disaster response. Now, if at all you are weak, you do not have well-defined infrastructure, then definitely that is going to suffer. Countries with well-developed systems are often more resilient and better prepared for disasters. Primary healthcare, this forms the basic foundation for any kind of response to emergencies. Now, in case of any basic kind of health problem, the first that comes into is the primary healthcare. Now, in our state, or sorry, in our country, what we do is, even for the minor ailments, we go to a specialized hospital. But if you look at the best example is the NHS, which is followed in the UK, where you have the general practitioners. You cannot jump and directly go to a cardiologist or to a super specialist. You have to go to the primary healthcare and the general practitioners, and they would take a decision on it, on the decision, and then would refer to you if at all you need special care. Now, that is where primary healthcare needs a very special mention in this and play a major role in controlling this. You do not want the people to wrong the super specialty hospitals or the teaching hospitals for minor ailments, those which can be tackled at the primary healthcare level. Now, it also contributes to the decreasing vulnerability and preparing households, communities, and health systems. The teaching hospitals are basically meant for the other purposes, but the primary healthcare is for this basic services to improve the health status. Now, community-based actions are there where knowledge of risks involve the local people, which local actions which prevent risks at the source. If there is a source that has to be prevented then and there before it spreads to the other parts of the state or the city or whatever, a prepared, active, and well-organized community can reduce risks and impact of the emergencies. And many lives can be saved after an emergency through community response before external help arrives. Now, in case of, suppose there is an outbreak in a remote place, if at all you can contain the source. Number one, you can plug the source there. Definitely, that will help in confining or containing it in that particular local area only. Now, there is a disaster. You have cordoned off the area. You have mentioned it or demarcated it as a containment zone. You confine it there. Call for help before the emergencies come. You have already done the local or taken up the local measures where you have contained the spread. Now, I'll just skip. I'll just take you through this. hospitals and health infrastructure in any kind of disaster, the load is always heavy on the hospitals. Whatever be the disaster, whether it's a natural disaster, whether it's related to health, whether that is man-made, everything at the end of the day, everything is on the hospitals. So safe hospital programs are very, very essential, which can withstand the stress and remain operational even in the crisis. Many hospitals have given up because they could not deal with the increased number of patients which had come in. Somebody's microphone is on. Can I request him or her to switch it off, please? Okay, thank you. Now, developing adaptable and resilient healthcare systems. Now, surge capacity, if at all the hospital should be able to deal with patients or take a load which is not usually planned for. Now, when we plan hospitals, suppose in an emergency we have planned for 10 beds. If at all there is 20 patients, at least we can convert some of the areas in the free spaces. At least we keep provisions so that that can be converted into an emergency zone. So those kind of processes or flexibility in the hospital design or the healthcare system is very, very important. The operational continuity plan. Now, how do you operate the hospital? It is not the surgical operations that I'm talking about. It is the operations here is about the running of the hospitals. Now, how do you operate on it? So you need to design your infrastructure that ways. You need to design your processes in a flexible manner so that it can be scaled up. And the mechanism for response, coordination, and effective communication, those are also vital points which need to be considered when you are planning for any kind of disaster. Now, this is again always a multi-sectorial action. Now, basic requirements which are there and the essential infrastructure. Now, when you're talking about basic infrastructure, that means the water, sanitation, nutrition, the security, which is also very important because people, when there is a disaster, there is a tendency that people will deviate away from the normal rules and the protocols. So security and all those are also very important. Then essential infrastructure, when we are talking about that, would include your communications, your logistics, your energy and water supplies, your emergency services, and the other community health services. Now, these are important because when you are talking about the essential infrastructure, nobody can live without food, shelter, and clothing. Now, you really need to provide the food and the shelter to these people. Now, when we see in many states of the Northeast, when there is a flood, people are evacuated and they are given a place to stay in, maybe in schools or maybe in a maybe elevated place. Now, in such a case, what happens is we provide the food and the medicines and the other supplies as well. So these are the basic requirements and the essential infrastructure. This has to be continued till the impending danger is over, number one. And for that, in my previous slide, I had mentioned the operational part and the sustainability part. Now, these two factors will play a major role or a very important role in this. Now, how do we prioritize the actions? It is number one, mitigation, then preparedness, response, recovery, and then prevention. Now, we divide it into priorities. Now, disaster risk management for health as a national and local policy. Now, when we talk about disaster risk management itself is a very, very big subject. Now, when it is applied to disaster, that it should be applied as a national and local priority, because we really need to identify the risks involved and how you are going to mitigate it, how you are going to analyze it, how you are going to analyze what would be the magnitude of that particular effect and how to minimize the after effects. Now, development of multi-sectorial strategies for policy, strategies, and legislation. Those are to be maintained. Now, health sector and multi-sectorial coordination mechanisms. Now, when we are talking about multi-sectorial, that would be your different levels to facilitate your joint action on risk reduction. Joint action in the sense different departments coming in, different specialists coming in, different organizations coming in, and response and recovery by the various health and non-health actors. Now, in case of health disaster, the only health professionals cannot control it. Now, it is also commitment of sufficient resources to support the disaster risk management for health. Now, what would be the priority two? That is health risk assessment and early warning. We really got the warning that this kind of situation is going to come, but were we prepared for it? We didn't. We were not. Assessment of risk to health and health systems, we did not do it. Whether our health system is capable of taking that particular load, we did not analyze it. Now, determining the risk management measures, what would be the measures that you are going to take if at all you have to manage the risks? So that has to be determined first. Then surveillance and monitoring of potential threats to health, particularly from your what you call your biological, natural, and technological hazards. Now, sources to enable early detection and warning to prompt action by the public, the specialists, the healthcare workers, and the other sectors. Now, these are the three broad elements. We have to analyze the hazards first, identify it, and assess the magnitude. Number two, which is again very important, is vulnerability analysis. Who are the people who are vulnerable to it? Number one, which segment of the population is vulnerable, and what kind of infrastructure that we need, and the other community elements to the hazards, those are required, that needs to be analyzed. Then the capacity analysis, whether we are going to, suppose we have done hazard analysis, we have done the vulnerable analysis, and we have found out that these are the number of patients that we can estimate to come in a particular period of time, whether we have that capacity to do that. We could not foresee the requirements of the oxygen in treating these diseases or treating the problems. People were planning for the ICUs. Many hospitals were planning for the ICUs, but did not have the oxygen supply, which is the basic requirement in any intensive care unit. So that was not planned properly. People could not foresee it. People could not do the capacity analysis. And that is why we are facing this kind of problems. Then priority three is your education and information. Now, what kind of education of the professionals in healthcare and other sectors? Also, everybody in healthcare is capable or what you call qualified enough to manage a patient in the COVID wards. Now they trained. They have got the basic training. What you need to do is the specialized skill management and all those training. The specialists can do the high-end kind of procedures or the other interventions, but the basic ones can be dealt with by the healthcare professionals. Then for household and the communities at risk. Now this is also very important, because otherwise what will happen is if we cannot contain the source which comes from the households and the communities. So those are the things which really need to be looked into in priority three. Priority four, when we talk about is reduction of the underlying risk factors, poverty reduction measures and systems, then infrastructure to remain functional in emergency situations. Many hospitals have given up, as I've already mentioned, that we cannot treat COVID patients. Now, another, what you call, a circular which came last year was that all the hospitals should have a COVID ward. I strongly do not support it, because not all hospitals are capable of treating COVID patients. Now, I was called by, that was a voluntary service which I did for many private hospitals last year. I tried to set up the COVID wards in their hospitals. Few of the hospitals, even in Guwahati, they were not capable of taking up COVID patients because the infrastructure did not allow. And so creating a COVID ward was very, very difficult. number one. Number two, in some cases, there was definitely a compromise because there was mixing with the general patients also, because of the passages. Those could not be modified. Those are permanent. Again, not realize that all hospitals should have COVID wards. Now, hospitals who are the cancer hospitals, why do you need a COVID ward there? Because people are already immunocompromised. Now, immunocompromised patients are more vulnerable. And when this vulnerable and the hazards meet, there could be a disaster. So this kind of special considerations should have been taken. But anyways, that has already gone. Now, protection of the other vital infrastructure, adherence to the building standards. Now, many of the buildings are built by violating the municipal and the national building code norms. Now, please, if at all somebody is building hospitals, please do not compromise on this municipal and the national building code norms. Do not violate. Minor violations would always be there, but major violations, please do not do that. Now, protection of the ecosystems. Now, protection of the ecosystems in the sense, in case of COVID, when we set up the the quarantine center in Horuhajai, it was 1,000 bedded. Now, imagine the huge number of patients that are going to come there. We had big problems when we were designing the toilets, the sanitation, and the waste disposal. Again, we had to take special care of the food items or the leftovers. So how to dispose them? Who is going to do that? Is it PWD or the public health engineering or the municipality? Again, the lot of 1,000 patients staying there and the lot of effluent coming out, going to the public drain. So that also needs to be considered. So again, if at all we violate and then put the effluent in the public drain, so that could be again a hazard. Somebody said that we are going to have that disinfection tunnel where we are going to spray sodium hypochlorite. Now, they were people did not have any idea that they wanted to release it in the public drain, which itself is again a public hazard. So again, if an effluent treatment plant or ETP was established, and now these are the care that you really need to look into. It might look as if it is very simple, but the effect that it might have on the persons, on the environment, on the entire ecosystem, that could be a very devastating factor. Now, priority 5 is preparedness, including your response planning, training, and the surge capacity we have already discussed, training of the healthcare professional, and emergency preparedness drill. Please do that in your hospitals because that is also very important. Then the development of the capacities, how you decreasing the exposures and the human susceptibility. Now, human susceptibility or vulnerability is through your vaccination drives, maintaining the precautions and the standard precautions and the personal protections, or those will contribute. Building resilience of individuals, communities, and country to protect the health, respond and recover effectively from the impact of the hazard. Now, impact of the hazard can be many, as I've already discussed. So I'm not going to go there again. Now, health and multi-sectoral policies, strategies, and legislations are to be very strict. Response and recovery planning, these are to be planned in a manner that again, sustainability and viability of the operations or the planning is something to be considered when you are designing it. Health sector and multi-sectoral framework and mechanisms. Now, again, capacities in health, what we really need to look into when you are planning for a catastrophe or a preparedness, look at the vulnerable patients, extremes of age, elderly people, young ones, people who are vulnerable, people who are less immune, people who have predisposing factors, the maternal and the newborn health, people who have got the lifestyle diseases, who have a greater tendency to fall sick or succumb to the ill effects of a particular catastrophe. So management of the communicable diseases, chemical incidents, radiation emergencies, I'll skip this. Mass casualty management. Now, in case of this pandemic, mass casualty, it's not a road traffic accident or something as such. But if at all there is a public gathering, maybe a family festival or family ritual or celebration or something, and if there was a positive patient or one or two positive patients, and the entire people who gathered in that particular function, they fall sick. Now, where to admit those? So in such a case, if at all you are planning for the processes and the protocols, please look into all these planning for the mass casualty as well. Now, mental health and psychological support we have described. Mass fatality management. If at all there is fatality, in case of say normal or natural disasters, you can dispose of the body in a normal manner. Now, if it is from an infection like the coronavirus, we really need to look into this disposal of the dead bodies also. Now, in such a case, you really need to look into the policies given by the authorized bodies, say the ICMR or Ministry of Health and Family Welfare. Now, if at all you are planning for a COVID ward, you take the highest number of mortalities that might happen on a particular day. So are you prepared to face that? Are you going to dispose that particular thing? Now, nutrition, trauma care, water, sanitation, and hygiene, these are very essential. Then again, safer and prepared hospitals and health facilities, they would have better management. Information, education, and communication networks. I'll just skip this. Now, these are the important measures in your approach. Number one is coordination, planning, financing, and monitoring. Coordination is, we have already discussed, financing and monitoring. Your finance plays a major role, because if at all you do not have the finance from, maybe it is a private hospital or a government hospital, you cannot run the show. You cannot run the operations. Then operational support and logistics and supply chain. Supply chain in the sense that logistics, maybe medicines, consumables, food, other items which are required. Now, in case of say a COVID ward, what would be the PPEs, the masks, and the other things used by the patient, by the caregivers, by the doctors? All those need a constant supply. Suppose there is something wrong in the supply chain and the logistics, you do not have a PPE kit in supply. Now, in such a case, even if you have the infrastructure, you have the processes, you have the manpower, again, because of one single problem, your entire chain is going to be affected. And the research and innovation, this is a very new virus. As we all know, we are still in the research phase. Somebody asks me what would be the future, I simply say I do not know, because the research and the the evidence-based kind of practice or the protocols, they are yet to come out. The researchers, the people doing the research are yet to come up with a concrete idea or concrete this thing that this virus behaves like this. This could be the effects, this could be the side effects, this could be the sequel that the patients might have. This is the treatment protocol, this is the treatment line, these are the adverse effects, this could be the death rate, this could be the preventive aspects and the rehabilitative aspects. That particular phase is yet to come. So please be prepared with all the things that we have discussed here. And I feel if at all we follow this kind of approach, then definitely we will be able to minimize it. If we cannot contain the virus, at least we will be able to minimize it, minimize the spread, minimize the infections and the other adverse effects. Also, it would also help you to prepare for the impending danger that might come, because people are predicting that the third wave will come in mid of September. Somebody says it's October, November. If it doesn't come, be happy. We are happy. But if it comes, we should be in a position that we are able to tackle it. We are prepared to face it. Now, these are the things which really need to be looked into: the search capacity, the infection prevention and control, then the case management, human resources, essential health services and the patient care, then surveillance and warning, early warning and monitoring, communication, logistics and supply chain management, diagnostic services and essential support services. So these 10 factors would comprise the basic requirements or the guiding principles or the main pillars in your entire preparedness plan for a catastrophe. This is a message which I always discuss at the end of my presentation. If you look at, suppose a patient comes to you, so he could be, number one, the only earning member of a family like this. Maybe he is the father of a newly born child. Maybe he is the husband of a newly married lady. Maybe he is the only support for his ailing, aged father. So when he comes to your hospital, when he comes to you, when he seeks help from you, always take care of him like your own brother, so that when he goes from your hospital, so he walks out of the hospital with a smile and with a healthy heart. So let's take care of him like our own brother. This is this message is not by me. This is by Dr. Lalu Joseph, says the quality head in CMC Vellore. And thanks for your patience, ladies and gentlemen. And last but not the least, big namaskar to all of you for being here and giving me the opportunity to speak on this particular very, very important topic. I don't know whether I have been able to do justice, but again, thanks to the organizers for allowing me to speak on this particular occasion. Thank you so much. If at all, if there is any question, I will try my level best to answer. If at all I cannot, I'll definitely make it a point that I'll revert back to you at a later stage.
Thank you, sir. Thank you very much for your very informative talk. I am sure all the participants have got enlightened after listening to you today. This will definitely help every one of us. Thank you so much, sir. Now I request if any participants have any question, then they can put in the chat box.
Maybe they can switch on the microphone also one by one. Maybe we will try to answer.
Yes, sir. Now we got one question. This is from Dr. Konkona, Dr. Fukan. She has asked, okay, what changes or what new course or subject can be introduced in the paramedical courses for preparing the students for such future catastrophe?
Just a second. Now, when we talk about, just a second. Yeah. When you talk about the courses, Konkona, am I audible? Okay. Maybe she is on mute. When we talk about the syllabus, we talk about the medical, the nursing, or the paramedical, or the allied health sciences syllabus. Please go through the syllabus if at all you have, or you can download. It is confined only to that particular subject. You know, somebody is studying medical, it is only the medical part that we are taught about. In nursing, it is a nursing services. In paramedical, how to do the processes and all. Nothing is taught about the patient safety, number one. Nothing is taught about the management. Nothing is there regarding your how to manage a situation if this kind of things come up. We are not taught about any disaster management plan. We are not taught about patient handling. We are not taught about the legal aspects. We are not taught about how to design our facilities. Suppose there is a lab technician. If you ask him how to design a lab, so he is not in a position to answer that. You ask about how to design a hospital to a doctor, maybe he will also fumble. The basic everybody would know, but in details, if at all you look at this kind of subjects or these kind of topics can be included in the curriculum. I design a lot of courses for universities, and also I have designed 4 programs for Indian Institute of Management, Shillong. So when we design, we look into the aspects where the practical aspects really need to be taught. We are talking about the treating the patient, everything related to the patient, but how to practically handle these kind of situations, how to practically deal with the patient problems, we are not taught. So these kind of topics, even if these are not included in your syllabus, I'm sure a lot many teachers or the trainers are here. So definitely you can include these kind of topics for your patient, for your students. If at all you need some other information, some more information, maybe I can help you out in preparing that. Maybe you can have workshops for having these kind of programs or this kind of sensitization for your students and the working professionals.
Thank you so much, sir.
Konkona, I hope I have answered your query.
Thank you so much, sir.
Yes, sir, thank you so much. Any more questions? Any participants? If you have any more questions, you can put in the chat box or you can unmute yourself. I think everybody understood.
This is what I'm going to say is on the lighter side.
Yes, sir.
Don't take it personally. Either my lecture was so good that everybody understood everything. Number 1. Number 2, it was so bad that nobody really wanted to know or really did not understand what I was trying to say. So if at all you do not understand, then definitely there is no question. Number 3 is something I have said something which is not within the scope of this discussion, maybe, but that was on the lighter side. Don't take it personally. But I would also like to have more questions if at all you have any, so that we can answer. If at all you don't have any, maybe we can close the session or not.
Yes, sir. I think there is no any questions because I have not seen any questions in the chat box till now. So with this, again, I thank to you, sir, and also our advisory board, chairperson, madam, our organizing secretary, joint organizing secretaries, all the other committee members, and the IT team. We come to the end of our 3rd day, first session, and we'll be meeting again at 1 p.m. in the afternoon for the second lectures, which will be given by Dr. Swati Tomar on COVID-19 and I. Thank you all, and I request everybody to give their feedback. It's given in the chat box and the WhatsApp group. So thank you all. Thank you, sir.
Yeah, thank you so much for inviting me here. My special thanks to Arnab, then Konkona and Getuwani madam for inviting me here. And thanks to Downtown University, and would be happy to have this kind of similar sessions in future. Thank you so much.
Thank you, sir.
Thank you for your wonderful speech and your effort in this deliberation. Thank you so much for sparing your time.
Thank you, ma'am. Thank you so much.
Nice to see you.
Yes, nice to see you again. So, namaskar.